Okay, our final speaker, Rolando Laranjeira, is a professor of psychiatry and addictive behaviors at the Federal University of Sao Paulo, Brazil, and he's the director of the National Institute on Alcohol and Drug Policies in Brazil. His work has included organizing Brazil's first national household surveys on alcohol and drugs, the study and implementation of alcohol and drug policies in the community, such as the closing of bars, zero blood alcohol concentration for drivers, partner violence related to alcohol, and violence and mortality related to crack use, the implementation of alcohol and drug treatment systems. And we asked him to speak because he does have some very relevant evidence of some of these policies that have been tried in Brazil.
Thank you, Peggy. I would like to thank the invitation to be here. For me, it's a pleasure and an honor to be in this building. And also to thank you to listen to such a different experience from Latin America that may be useful to the United States. I have two messages in my presentation. The first message is to give you a general view how is the alcohol market in Brazil in particular. And the second message is what you did that made a success in terms of decrease homicides in one city near the city of São Paulo. I think it's important for us to know, in terms of the global burden of disease, the alcohol affects some different countries, particularly Latin America and Russia is a completely different view, and than North America is some of the European countries. And Brazil is right in the middle of this important impact of alcohol in the global burden of disease. And the city like São Paulo is a huge city, more than 15 million people together, and make the impact of alcohol completely different than the countryside in the area of Brazil. What are the challenges? In Brazil, we have an unregulated alcohol market, and of course, a strong interest of the alcohol industry. I will discuss a little bit what I mean by an unregulated alcohol market. We also have a network of politicians with close interests with the alcohol industry. And policymakers in Brazil are not very educated about alcohol policy. No community involvement in alcohol policy, and very few good examples in my country. What I mean by unregulated alcohol market. In Brazil, we have 1 million places selling alcohol, which is visited weekly by the alcohol industry. And 70% of these places, and then we have 1 million alcohol in the one place selling alcohol, 200 inhabitants in Brazil. Brazil have around 200 million people, and we have 1 million places selling alcohol. And 70% of these places has no license as business. I'm not telling you that alcohol is a license to sell alcohol. We don't have this system in Brazil. Anybody can open a place and sell alcohol. That's what I mean by an unregulated alcohol market. 30% of the intoxicated drivers on weekends, if we randomly stop people driving, around 30% of them has some alcohol on their blood. Teenager can buy alcohol in 90% of the premise. Price in Brazil is extremely cheap. 1 liter of our spirit, which called pinga, costs $1. 1 can of beer is 30 cents of a dollar. And to show you that I know a little bit about the dollar and Brazilian, is 1 liter of orange juice in Brazil costs you $3.5. And alcohol is, that I mean by unregulated alcohol market. That's, anybody can open a bar on your house, have a window that you can sell alcohol. It's that sort of place. For me, a good example of unregulated alcohol market, that's the biggest company in Brazil today is a beer company, Ambev, which is one of the largest beer company in the world. In Brazil, is the biggest company. Last year, we Petrobras, which is our oil company, used to be the biggest company. Last year, Ambev became the biggest company in Brazil. Thus, selling beer is more profitable than selling gasoline or oil in Brazil. That's the size of the problem. Of course, you have a very aggressive marketing for alcohol. Worst of all, for me, this year we know that you have the Football World Cup in Brazil. And FIFA, the international body, I wrote an editorial on addiction in 2002. And we had a national law forbidding alcohol to be sold on the stadiums. A very good law, because we saw that if you sell alcohol in a place where you have 1,000 men shouting for their teams, the violence is widespread. And we had a law, and FIFA imposed in my country to change this law for the World Cup to happen in Brazil. That not only FIFA, but the alcohol industry. And worse than that, the Brazilian government changed the law. And then we will have a World Cup with beer on the stadiums. It will be interesting to know what happened. But that's the message. That's what I think is important to know, what an unregulated alcohol market is. And when I go abroad and talk to my friends worldwide, I don't think people can realize, people live in America, in Europe and so on, what an unregulated alcohol market is. And that's, I think, Brazil, unfortunately, is a good example of what an unregulated alcohol market is. Well, despite that, we did the city of Diadema, that's the positive message that I'm trying to bring to you today, is what happened in the city of Diadema is on the state of São Paulo, is near 20 kilometers from the city of São Paulo. And what was happening there? Diadema is a city, is a medium city, it's around 350,000 inhabitants. It's a very dense city, and the population are low middle class. Well, what happened around the 90s? The community had very high rates of homicides, 102 homicides by a group of 100,000. It is the biggest in the world. Nobody can dispute that. And the majority of these homicides happened between 9 p.m. and 6 a.m. The mayor of the city realized that, and that they passed a municipal law against that. Of course, the violence against women, of course, it was also important. Then they passed a municipal law in 2002, very basic law. Any place who sells alcohol has to stop selling alcohol from 11 p.m. to 6 a.m. What was most important, than particularly in Brazil, that the law was enforced. Every night, they had the police going there, checking if the bars were closed. That was the trickiest part of this law, because Brazil was full of laws, but unfortunately, they are not enforced. This law was really enforced. That's the whole difference. And the population, 90% of approval after a year, even after now more than 12 years, the support for the law is as strong as ever. Well, the local police had the fiscalization every night. First time someone was caught, they received a warning. The second time, a fine. The third time, a fine and a working permit license suspended. As I mentioned, 70% of the bars in Brazil has no license whatsoever, even though they obeyed this law, because the enforcement was very active. It was interesting to see even people who are completely irregular, they follow the law. And then the police was really active on this part of the city. Then we published a paper in the American Journal of Public Health where we show, we have this line, analyzed 10 years before the law and then the implementation. It was a collaboration with Pacific Institute of Research Evaluation with Professor Joe Group, because it was a complex statistical analysis and it was very interesting. And what the statistical analysis showed that after 4 years of the law, the numbers of lives saved, it was 528, with a reduction of homicide in 46%. It was a very had an important impact in terms of homicides. And we are analyzing now what happened after 12 years, but unfortunately I don't have the complete analysis. But the rough data can show that the homicides still decreasing. For example, in 1911, it was less than 10 by a group of 100,000 inhabitants. That's 10 is what the WHO considers as an epidemic in terms of homicides. Then it goes from 1999 from 102 and reaching 10, 12. That was a consistent decrease of homicide. Even in assaults against women, there is an important decrease over the years from 1999 to 2013. I think that was an important implementation of the law. Several other cities have also implemented this law. The difference, I would say, from Diadema and from other cities, that the city of Diadema has kept the fiscalization. Other cities also passed a law. There was initial success. There was a decrease of homicides, and then the fiscalization has relaxed, and then the homicide rates come back again. I think it's important experience in Brazil showed that we can do important work, particularly in this place where Brazil, unfortunately, is an extremely violent country nowadays, and also with a high alcohol consumption. And this combination, we have to try to find models, simple models, which can be implemented and make a difference in terms of public health. Thank you very much. I finished before. Thank you.
Thank you.